concentrate. Okay. Chancellor. Very well. You always. Good afternoon, everyone. I'm Nick Manchione. I'm the Director for the County's Health and Human Service Agency. Thank you all for being here. As we're all aware, we're facing a triple viral threat. These are three well-known viruses in widespread circulation, with two of them at very high numbers. First, good news, COVID-19 is declining, but we are weary about the holidays coming up. Bad news, flu numbers are increasing, and by next week should exceed what we saw in all of last season. And we have a third common respiratory virus known as RSV that's striking an uncommon number of children. So we want to set the stage here today for 4 actions. 1, explain what the county is doing. 2, explain how our healthcare and community partners are stepping up and doing. 3, explain what our state and federal partners are doing in support of our local efforts. And lastly, and very importantly, what we need San Diegans to be doing to protect themselves, their families, and their friends. Thanks to really some great timing, we are honored to have with us today the U.S. Health and Human Service Secretary, Javier Becerra. And he'll be introduced shortly by our County Vice Chair, Supervisor Nora Vargas. But, you know, I didn't want to miss the opportunity of not thanking the Secretary, because we could not have gotten through COVID-19 without the extensive federal assistance from all of the Health and Human Service departments. And I want to personally thank the Secretary and his great team for their work and commitment. And if you follow the Secretary, you quickly learn he's a champion for community outreach and engagement and taking services to where people need it the most. I'd also like to highlight just a few of those efforts in San Diego that relate to our approach to defeating the threat of these 3 viruses. Key to our efforts, right from the start, was going mobile for health equity. What do I mean by that? Well, through the leadership and support of our County Board of Supervisors, we brought services to the communities that needed it the most. Since July of 2021, our 2 Live Well on Wheel buses have taken part in 531 events, providing services to more than 63,000 people. Those services have included more than 14,000 vaccinations, both flu and COVID-19. Speaking of those valuable rolling assets, thanks to funding from Health and Human Services, the federal government, we're preparing to expand our fleet with the order of 3 more Live Well buses. Another example of meeting people where they are has been the distribution of our home test kits for COVID-19. And since April of this year, more than 66,000 have been distributed through libraries, community events, clinics, and homeless shelters, all with the emphasis on locations of highest need. These are just a few examples of the tremendous efforts through the many community-based partnerships that we have. And one of those key partners has been the University of California, San Diego, through their health system and medical school. The UC San Diego Chancellor, Pradeep Khosla, is here with us today to discuss how our largest university in San Diego, with its cutting-edge scientists and clinicians, have been champions for our most vulnerable. Dr. Wilma Wooten, our county's public health officer, is here, and she will share the local view on what we are seeing on the ground with the triple viral threat and our public health response. Here to talk about our youngest is Dr. Patrick Freyes, a physician himself first, and then the CEO of Rady Children's Hospital, and a major champion of children's health. Students in San Diego's 42 school districts, representing the 2nd largest school district in the state of California with over 600,000 children, has given us early insight into the spread of these viruses. So here with us is Dr. Paul Gothel, the San Diego County Superintendent of Schools, who will discuss the education experience and response. And we're also joined by Anna Malgoza, the Vice President of Internal Affairs for syncytial Health, who will share how her federally qualified health center works to educate, vaccinate, and meet the healthcare needs of underserved San Diegans, particularly in South County. Now, in the room with us are some other key leaders who will not be speaking, but I'd be remiss if I didn't mention them because they play a critical role in protecting the public's health. From UC San Diego Health, we have CEO Patty Mason, along with our other hospital system and community clinic leaders, our San Diego County Hospital Association and San Diego County Medical Society. Also, we have the county mighty team from Health and Human Services with Dr. Eric McDonald, our Chief Medical Officer, Dr. Kelly Modadell, our Child Health Officer, and Dr. Seema Saw, our Chief of Epidemiology. And very importantly, I have to make a statement about the incredible committed county team with the Health and Human Service Agency, or 8,000 strong, and in partnership with our labor unions. And with us today is also Crystal Irving, president of SEIU 221. Thank you. Now, with that, I'd like to formally introduce Vice Chair Dora Vargas, a true champion of health equity. In addition to the County Board Chair, Nathan Fletcher, I had the privilege of seeing firsthand Supervisor Vargas day in and day out doing some really amazing work in the community response to COVID-19. And I can verify she is the real deal. With that, Vice Chair Vargas.
Buenos dias. Thank you, Nick, and welcome everyone. First and foremost, I really want to thank Secretary Javier Becerra for being here and for ensuring that our federal government has a direct pulse on what is happening at the ground level in our communities. I've had the pleasure and the honor of knowing Secretary Becerra for over a decade, I think, if not more. We're going to say over a decade. His commitment to equity has been unwavering. Over the last couple of years, your leadership, Secretary, and the Biden administration's leadership has been crucial in helping us ensure that our communities are safe and healthy, especially as we face unprecedented health crisis. Today's visit highlights the great collaboration and partnership between our county and the federal government. And this is what it takes to make sure that our communities are safe and that they get the tools and the resources that they need to make sure that they are thriving and not just surviving. I had the honor and the pleasure of being a healthcare advocate for over 30 years, and I have learned firsthand that each community is different. And to reach and to engage them, you need to have trusted messengers that deliver that message not only in their language, but also understand the community and the culture. This was never truer than when we were trying to ensure that our communities were safe and healthy during the pandemic, as we deployed our promotora programs and our community health workers to directly engage and help residents navigate resources that were available. This innovative strategy was key to breaking down the barriers and ensuring an equitable distribution of vaccines and resources into our community. One of the best examples is the work we did in the community of San Isidro, one of the most impacted communities by COVID-19 in the state of California. I am proud to share that we were able to reach 99% vaccination rates among eligible residents. And so as we approach the winter months and a trio of respiratory illnesses of concern being present, San Diego County is ready to meet any challenge that comes our way. Our community is knowledgeable and better prepared, and our county staff has demonstrated that we are going to do everything in our power to make sure that we keep our communities protected and they are health and safe. As the safety net of our region, we will work to make sure that every resident has access to the services and resources that they need so we can continue to build healthier and stronger communities in partnership with so many that are here present today. Buenas tardes, me da muchísimo gusto tenerlos aquí, invitarlos a que estén presentes. Quiero dar primeramente las gracias al secretario Javier Becerra por su visita al condado de San Diego. Estamos sumamente contentos de recibirlo porque sabemos que su visita demuestra un gran compromiso en estar directamente informado de lo que sucede en nuestras comunidades. Eso no debe de asombrar a nadie, ya que el secretario ha tenido esa manera de trabajar, no habla solamente de equidad, pero él de veras hace el trabajo mano a mano con nuestras comunidades y sabe lo importante que es estar en contacto con las comunidades. Su liderazgo, secretario Becerra, y su gran colaboración con la administración del presidente Biden ha sido para nosotros el gran apoyo que ocupábamos en esta comunidad, particularmente en las comunidades que estaban más impactadas en el sur de la región. Ahora que ya llega el invierno, que está muy cerca, y sabemos que tenemos un trío de enfermedades respiratorias presentes en nuestra comunidad, estamos preparados más que nunca como condado para enfrentar cualquier reto y estamos muy agradecidos con el gobierno federal, con los recursos que nos presentan y las oportunidades para trabajar juntos para mejorar nuestras comunidades. Hemos demostrado durante esta pandemia que nuestra respuesta siempre será rápida, eficaz y seguirá siendo innovadora. Vamos a utilizar todas las estrategias necesarias y los programas que se nos brindaron, que nos dieron éxito durante la pandemia para salir adelante. Una vez más, muchísimas gracias al secretario Becerra y a su equipo por visitarnos ahora y que tenemos un día pleno de diferentes conferencias. Ahora, it is my honor to welcome the 25th Secretary of the Department of Health and Human Services, the first Latino to hold this office in the history of the United States, and a good friend, the Honorable Javier Becerra.
Supervisor Vargas, first to you, Madam Vice Chair, thank you for the invitation to join with you, to all the leaders here in the San Diego County area for the work that you are doing. Very much appreciated, and we will, let's just say that we at the Department of Health and Human Services, under the Biden administration, we won't be like those delivery services where we drop off a product, knock on your door, and before you can answer, we're gone, the product's there waiting for you. We intend to be there with you all of the steps, every step of the way as you tackle all the challenges that we have. I just came from Orange County, which, as you probably know, has declared a state of public emergency because of the RSV virus. And here's the good news. We know everything it takes to keep us safe during this triple threat. And we also have the tools, the medicines, the know-how to address that triple threat. Here's the challenging news. Will everyone listen? And that's become the issue of our time. If we have Americans today that are dying of COVID, 300 or 400 a day still, we know that they could be alive today. I guarantee you that most every one of those 300 to 400 could still be with us today if they had just followed what we know. Chances are they were not vaccinated or not updated in their vaccines. Chances are they were immunocompromised. We could save lives today. We know how to do that. And when it comes to the flu, this isn't new to us. It should not surprise anyone that we're seeing the flu come back with a vengeance, because for 2 or 3 years, we haven't had our kids and our families out there socializing on the playground in schools the way they have before. And so we've been protected. All of a sudden now we're out there congregating because it got better when it came to COVID. And now the flu is hitting. And RSV is not new. There isn't a vaccine for RSV the way there is for the flu or for COVID, but we know what we must do. And so my message is pretty straightforward to the folks here in San Diego County, my great state of California, and to all folks in this country. Let's be smart. Don't pay attention to that misinformation, to that disinformation. Talk to those you trust most, your doctor, the people that have guided you through most of your life. And then please, this is a team effort. Help us. Don't let your kids get infected and sick if you don't have to, because you know how to take care of them. Please don't go into the holidays and expect to hug and kiss your family members freely, safely, if you haven't gotten vaccinated. And certainly, please, at a time when there are children's hospitals throughout the country, all of our hospitals throughout the country need to have every bed available in the event that a child needs a bed because of RSV or because of the flu or, God forbid, because of COVID. Let's not take up those beds because we didn't do what we could to protect our family members and our loved ones. It's very simple, and I encourage you to do what you can. It is frightening when your child cannot breathe. I say that as the father of 3 daughters. You will do anything you can to keep your child safe and warm. But please recognize that there are some kids who absolutely need to go to the hospital. And there are absolutely things that you can do to prevent your child from being one of those. Help us make sure there's a bed available for your child or for your grandmother during this winter season when we know the virus is hit the hardest. This is a triple threat, whether it's COVID, the flu, or RSV, and the federal government, as I said, is not going to act like a delivery service. President Biden has made it very clear. We will be by your side, however we can, to assist and support your efforts. You just need to let us know, and we will be there. We know what we must do. You know what you must do. Everyone has to play a part, whether you are a physician or whether you are a county public health worker. We know what we have to do, and we can do it together. But if you are a parent, if you're a family member, if you're a community leader, please, you know what you need to do as well to keep us all safe. I will close by simply saying we do this to keep our families safe and healthy. We do this so we can truly celebrate the holidays that are coming up. But do me a favor, do this as well for those health heroes who've been working day in, day out for the last 3 years, who are exhausted. They're burnt out, but they are so resilient, and they will be ready for this winter as well. Do it for them so that we don't lose them, so that they don't leave this profession, so that they can inspire others to do this work in the future. We can do this together. Help us avoid the disinformation, and then we will be ready to tackle this as we have so many different challenges that have come before our country. I am thankful to be here in San Diego. I even dressed like I thought I should dress in San Diego without the tie. Actually, you all made the mistake. I didn't make the mistake. I'm in San Diego, and I just simply want to say to you, it is such a thrill to be home and to see how people do things the right way and how people care about not just themselves, but the greater family. So thank you for including me in this effort to let the San Diego population of this county know that we're there to help. Thank you.
Thank you, Secretary Becerra. Your call to action is spot on, and one that we are in pursuit to do. And thank you, Vice Chair Vargas, for your remarks as well. Now, it's a great pleasure I introduce Chancellor Khosla, who's expanded access to his campus at UC San Diego to underserved populations and strengthen his world-class university relationship with our communities. Chancellor?
Thank you, Nick, and thank you, Mr. Secretary, for visiting our great city, our binational city out here. UC San Diego, as you all know, has a long history of working closely with partners around the region, especially on health initiatives and academic initiatives. And because of these long-standing relationships, we were able to quickly mobilize during COVID-19 pandemic. It seems a long time ago. March 2020 was not that too long ago. It was barely like 2 years and 6 months ago. At that time, our experts, including physicians, epidemiologists, disease modelers, researchers, engineers, data scientists, got together literally overnight, and we did two things really well. We basically built a strong protocol for keeping our campus safe, working closely with our health system. And then we worked together to leverage our medical expertise and new technology and help impact the county of San Diego, working in close collaboration with the county, with the city, and the population of San Diego. So what did we do? We partnered with other experts in the community, and here are some of the amazing things we did. The first vaccination superstation in the state, in partnership with the county, city, Padres, and ACE, the parking garage company of all places, right? It's purely amazing, truly amazing. The first mobile vaccination clinic to reach San Diego's most fragile and most vulnerable populations towards our borders. In partnership with Google and Apple, we helped roll out California CA Notified across the state, which of course helped with slowing the pandemic down. And we developed wastewater testing, and we tested not just on our campus, but even today, we test Point Loma literally on a daily basis and going forward every other day basis to keep track of the virus counts in the city. We have also developed a test for monkeypox and SARS-CoV-2, and these data that we collect from Point Loma are helping our scientists predict the viral transmissions that we are able to look at. So I want to close by saying UC San Diego Academic Enterprise and UC San Diego Health are strong believers in access, and our access goes throughout the state and broadly defined throughout the country. We want to be the role models. So UC San Diego, more than a third of our incoming students are people of color, and first-generation people. For UC San Diego Health, more than 41% of our patients in our health system, or nearly 41%, are Medi-Cal and uninsured patients. Last year, we had more than $600 million in uncompensated services. I point this out to basically make the case that we are an institution that believes not just in excellence, but we also believe in access, and we believe in access both to education and to high-quality health care for every person in San Diego County. So thank you very much for being here, and I just want to acknowledge my partners here, besides the city county, my colleague Patty Mason, who's sitting in the audience, our CEO of our health system, so thank you.
Thank you, Chancellor, for your great leadership in being a stellar safety net health system for our region. You know, in San Diego, we're fortunate having one of the nation's leaders in public health right here in San Diego, providing the guiding light and voice of truth in navigating the pandemic. And she has done this not just in COVID-19, but over the last 20-plus years. And that is Dr. Wilma Wooten, our County Public Health Officer.
Thank you, Nick, and good afternoon, everyone, and thank you for being here today to help drive home the important message, and there are many messages to help protect the public. Information, as you know, has been in the news over the past month related to the 3 infections of COVID-19, influenza, and respiratory syncytial virus, or RSV. While COVID-19 is slowly decreasing in terms of cases and hospitalizations, this virus is still circulating in our community. In addition, the county is seeing an early spike of flu and the RSV cases. Flu cases rose by 1,198 cases or viral detections in the week of the CDC week 43. Reaching 3,735 viral detections to date for this flu season compared to 265 cases at the same time last year. Flu cases typically do not peak until December, and sometimes even in January or February. During December, RSV begins to increase. While not an officially reportable disease, regional RSV cases reached 1,020 through October, or 2.5 times higher compared to 407 cases for the same period last year. A large number of flu cases this early in the flu season typically means flu activity is going to be sustained and possibly more severe. With more viruses circulating in the community, healthy people and particularly those individuals that are immunocompromised are at a higher risk of getting infected. So this year, more than ever, it is critical to get vaccinated. There are vaccinations for both flu and COVID-19, and these vaccinations take 2 weeks to become fully effective after they are obtained. So people should get both vaccines as soon as possible, and both can be obtained at the same time. I want to also emphasize the point that if you have had your primary vaccine series, we encourage you to get the bivalent booster shot. An individual can also get vaccinated at their healthcare provider's office, at pharmacies throughout the county, as well as at one of the county's public health centers. In addition to getting vaccinated, San Diegans should also take additional preventive measures to avoid getting sick. And we've talked about these every time we've had a press conference, but these strategies are tried and true, and they do work. The first is consider a well-fitting, good quality mask, especially if you are indoors in crowded locations. Wash your hands thoroughly and often. Use hand sanitizer if you are unable to wash your hands. Stay away from individuals that are sick. Avoid touching your eyes, your nose, or your mouth. And clean your commonly touched surfaces frequently. And most importantly, besides getting vaccinated, if you are sick, stay home and avoid contact with others. As has been stated here today, this entire process and response to what's going on in our community right now is a partnership. We have our healthcare partners and our school partners here today, along with the county, but the public is also a partner. And we urge you to adhere to these preventive strategies to help keep you, your family, and your communities safe. Thank you.
Thank you, Dr. Wooten. You know, it's not often you see a hospital headed up by a physician, and that's what we have with Dr. Patrick Frias, the CEO of Rady Jones Hospital. And his hospital is really a true partner and a daily lifesaver for our youngest lives in San Diego with their great team. Dr. Frias.
Good afternoon. Thank you, Nick. Thank you, Madam Vice Chair, and thank you, Mr. Secretary. I couldn't agree more with your words. So the three viruses we're talking about today, RSV is having the biggest impact at Rady Children's and across our children's hospitals across our nation and our state. It's important to note that RSV is nothing new. We see this every year across our communities. The difference this year, as you've heard from Dr. Wooten, we're seeing it much earlier, and we're seeing it at a much higher rate. And we're also seeing it at a time where we're coming through COVID, and we're seeing an increase in the flu. So that confluence is resulting in a significantly higher demand of pediatric cases that are utilizing our emergency rooms, not only here in the children's hospitals, but across all the hospitals in our region and many across the nation. Now, in most children, RSV results in a mild illness, more like the cold. You got low-grade fever, get over it in a few weeks. But in some, particularly in some children that have chronic disease or asthma or other illnesses, it can result in significant illness. And as the Secretary noted, we really need to make sure that the resources that we have are available for those most vulnerable who truly need those resources. So similar to what we saw during the COVID surges, with more illnesses, there's more demand for the healthcare services. And that in the end is straining the resources of all of our health systems across the region, from the emergency rooms to the urgent cares and to the clinics. And as you've heard already today, what can you do as our partners in the community? Well, I'd like to offer three, and I think you've heard them already, but I want to reiterate them. First, get yourself and your family vaccinated for COVID and for the flu. While there's not a vaccine for RSV yet, getting 2 out of those 3 out of the way and avoiding significant severe illness will make a significant difference in our community. Second, if you or your kids are sick, stay home. Please don't go to school or go to work. Wear your mask, all the things that you heard from Dr. Wooten. And third, we also want to make sure that you get the right care at the right place at the right time. So please start by speaking with your primary care provider, those that you trust in your community that can help guide you to the right place at the right time. I'd also like to remind families that we have lots of information on RSV and also on where and when to seek care on our website. And I know that all our community health system partners do as well. So please take advantage of those resources available. I encourage everyone to use these resources to make the best decision on when and how to access emergency services. Our health systems are vital to our community, and we want to be sure that the sickest in our community have access to those resources when needed. So as we prepare and we actually see an increase in the flu surge and continued COVID, it's more important than ever to take the steps to be healthy. Thank you.
Thank you, Dr. Frias. When you oversee the state's second largest school district in its size and its diversity, you better know your students, you better know your staff and the parents. And we are exceptionally fortunate in San Diego in having a leader that does just that, with Dr. Paul Gothold, our superintendent for the County Board of Education.
Thank you, Nick. Thank you, Vice Chair Vargas, Secretary Becerra, members of the health community. While we stay vigilant around the 3 viruses that are circulating in our community, it's important that we continue to work together to keep each other healthy. In the case of schools, we have learned many lessons from the height of the pandemic that can support our collective efforts to care for staff, students, and our families. San Diego County Office of Education, the local schools have established a very close working relationship with public health and the region's medical sector. We regularly collaborate to share information and health practices, recognizing that more than 500,000 children and their families are counting on schools to be safe and healthy places for learning. Over the past 2.5 years, Many schools have upgraded air filtration systems to mitigate the risk of COVID-19. These upgraded systems are also helpful tools to battle against RSV and the flu. In addition, many of the non-pharmaceutical mitigation efforts that have been mentioned, such as hand washing, covering coughs, staying home with sick, are also being reinforced. These simple but very important practices. And schools continue to clean and sanitize surfaces as part of the broad approach to help stop the spread of viruses. Protecting the health, safety, and well-being of our community remains a top priority for schools and an important prerequisite for students to learn and thrive. One of the good things that came out of the pandemic was how our office and county health are working much more closely together and are better equipped to respond to our school communities when in need. And as a parent myself, I want to reassure the community that we have the resources, collective experience, and by everyone doing their part, we will get through this. And to reiterate what was said earlier by the Chancellor in our partnership with County Health Board of Supervisors, UC San Diego Health, astounding when we got into the pandemic and the vaccine became available for COVID, we were able to offer 88,000 school employees an appointment to get that vaccination within 10 days. That confluence of effort and coordination speaks to the relationships, the partnerships of this region and the can-do spirit of San Diego. I know this is remarkable because my colleagues in the rest of the state were green with envy. So in appreciation for the Secretary's support, our Board of Supervisors, thank you. We'll do whatever it takes to keep our kids and families safe.
Thank you, Dr. Gotthold. You know, the old YMCA adage that strong minds, strong bodies is a single thing, holistic. And we are fortunate that Dr. Gotthold and his whole team is not only educating our students, but keeping them safe and healthy. In a diverse county, larger than actually some states, I think we'd be like the 22nd state if we were a state of San Diego. You need partners who have earned the community trust and demonstrate fierce commitment to health equity. And that's what we have with syncytial Health and our other federally qualified health centers. And we're very fortunate today to have with us from syncytial Health, Vice President Anna Malgoza.
Thank you so much, Nick, Vice Chair Vargas, Secretary, and my colleagues, thank you so much. So the South County is a very, as Nick mentioned, very high density, very wonderful community to live in. Syncytial Health has been the medical trusted provider of care for the last 53 years. Our goal really is to improve the health and well-being of the communities we serve with access for all. And many of our communities, for the longest time, continue to really struggle when it comes to taking care of their health because of many different factors. But I'm here today to say that our work can be done without our partnership with the county in vaccine outreach, education, combating misinformation, and vaccinating many of our hardworking families in our urban and rural communities. We heard time and time again, I held out on getting the vaccine until I spoke to you, and you were able to explain to me what COVID or the flu would do to my health and my underlying conditions. We also offered a testing and vaccination with care campaign where we worked to establish a long-term relationship with community members who had none before the pandemic, and as a result, delayed in getting life-saving care. For us, one preventable death was still too many. And at the early stages, too many of our community members were dying because of COVID. It's this trust and the partnership with the county in supplying tests, timely test results, vaccines, boosters, monoclonal antibody treatment, and all the additional resources which allowed us to work with our patients and our hard-to-reach families. Collectively, as Vice Chair Vargas pointed out, we went from the highest infected areas in the county to the highest vaccinated areas and turned the hospitalization and the death rate down substantially. For that, we thank our Board of Supervisors, our Vice Chair Nora Vargas, county staff, and the critical support and leadership of state and federal health officials. Your equitable response and investment to our needs turned the pandemic tide and saved many lives. We appreciate this vital partnership, and we continue to combat COVID, its new strains, and now the rising cases of RSV and the flu. In fact, we invite you to our Super Saturday flu vaccination and mini resource fair this Saturday, November 5th, from 8 a.m. to 12 p.m. at our clinic locations in San Ysidro and Chula Vista. Free vaccines will be available for adults and children 6 months and up. We will also offer no appointment walk-in services, including immunizations, lab services, dental, HIV testing, blood pressure checks, women's health, and so much more. You don't want to miss out on family time this holiday season. Get vaccinated and let's stay protected together. We have the tools and the resources to have succeeded before, and every expectation we will in the future. It's not so much that sí se puede, because we know we did. Now it's como se puede. This is how. Get vaccinated. Thank you.
Thank you, Ana. That's incredible, the work that you do and what you're providing for the community. Look, this is wrapping up, and I think it's been evident, right, from our Secretary Becerra to our Vice Chair to our state university, our hospitals, schools, and clinics, that our community in San Diego is coming together for the public good. But we need the public piece to help us. And as it's been pleaded with, and I appreciate the media being here, we need to get the word out to educate and vaccinate. It is really our way. It's the best holiday gift you can give if you love someone, to yourself and to our community. So thank you all for being here. This concludes our event, and our speakers will be available for any one-on-one momentarily. But first, please give us a moment. We'll take some photos, and then we'll be available for any of the speakers. Thank you all.